Plateau State Governor Caleb Mutfwang says his administration is currently taking steps towards curtailing the spread of malaria in the state through the distribution of treated nets and by engaging communities on the need to maintain a healthy environment. Governor Mutfwang, represented by Commissioner for Health Cletus Shokok, disclosed this in Jos East local government area during the 2024 World Malaria Day. According to him, climatic changes and humanitarian emergencies are displacing populations, making them vulnerable to the disease. Plateau State Malaria Eradication Program's manager, Ndak Kazito, said this year's theme, accelerating the fight against malaria for a more equitable world, is aimed at ensuring that malaria is reduced, if not completely eliminated.
We are trying to shift holding programs for the elites. Let the people in the rural areas have a feeling that the government exists. Ordinarily, we would have organized this in a hall whereby it's only the elites that will come and have presentation and go. But we've made it a duty to always identify with the people living in the rural areas, in the slums, to have a feeling of what the government are doing. And that inform our choice of FOBOR in Jos East local government to come and hold this particular program, go around. Today is our market day, to go around the market, and which we did. We've gone around the market educating people about the need to live a healthy life, especially to prevent malaria.
The Executive Governor of Plateau State, through the Commissioner and all other directors under the ministry, for choosing our local government, Jos East, to be a local government that they are here to sensitize our people. You know, whenever any program is being conducted in your local government, I think you are the first beneficiary or you are the first celebrant. So I want to, first of all, appreciate them for choosing Jos East.
Let's bring in Chuks. He is the Integrated Vector Management Officer of the FCT Malaria Elimination Program. Thanks for coming on the show.
Thank you.
Happy World Malaria Day, if there's any such thing. That would mean, of course, that Nigeria really is stepping up its game on pushing back on malaria. And I'm curious as to why, with all the different programs against malaria, kick against malaria or kick out malaria and all manner of programs, Nigeria continues to share, have a huge burden. 27% of the global cases in Nigeria. That's quite scary.
Good evening. Thank you very much. Malaria is a global fight. It is not something that one person can do alone. And so there's been collaborative efforts, both on the part of government, partners, and individuals, to see that the malaria burden is brought down to bearable maximum, if not completely eliminated. And so, you see, it's something of awareness, because once you are aware of the disease, you'll be able to know how to control and prevent. So a lot is being in place, done, like sensitization. The World Malaria Day, as it stands, is a day set aside to create awareness.
Right.
And then also to remember those who have lost their lives to this preventable and curable disease.
And in Nigeria, according to 2021 statistics, about 190,000, over 190,000 have lost their lives to malaria. Let's talk about the significance of the theme, the theme for this year, accelerating the fight against malaria for a more equitable world. Help us understand exactly what that means. I mean, how does inequity fuel the spread of malaria? Talk to us about that.
Yes. Before now, malaria was seen like, the most vulnerable groups being the women and children. But right now, it is being spread to both adults and everyone.
Yeah.
The awareness is not just, it's going globally and then ensuring that everybody understands the burden of the disease, how to control, prevent, and treat them.
Okay, so let's start from the individual level. Every now and again, when I mean, a Nigerian will just decide, maybe they're feeling weak or stressed, and they say, look, I think I have malaria, and that's where it ends. I think I have malaria, and you go to the pharmacy and you get yourself some anti-malarial drugs. Is that a factor in, you know, making this even more complex in treating, where people just go over the counter, pick up any anti-malarials and
Definitely,
yeah.
it is, because the guideline says that when you feel these symptoms, you go to the nearest health facility, get tested,
Right.
and if it is malaria, you take the appropriate anti-malaria medicine, which is artemisinin-based combination therapy. Any other thing outside this is not correct. Because sometimes you could feel these symptoms, even fever, and it's actually not malaria. It could be fever due to maybe bacteria or other things. And so we want everybody to be aware that the first thing to do is to seek prompt and early diagnosis and treatment.
Right.
That is by presenting yourself to the closest health facility, getting tested, and then taking the appropriate anti-malaria medicine.
Absolutely. Now let's talk about the community level. Some experts say that Nigeria's environmental structure contributes in breeding malaria. At the community level, the environment level, what do we need to do to help ourselves, you know, to push back malaria?
Yes, is to ensure that we have a very clean environment. Ensure that there are no stagnant water, because that is where the malaria vector mosquito breeds. And so if you have a clean environment, no stagnant water, no dump sites, it will not be favorable for the malaria vector to breed around the community. But I think we still need to do a lot of sensitization to that effect. And so that is why even today, being the World Malaria Day, the FCT administration, under the leadership of the Mandate Secretary, Dr. Adedolapo Fashawe, we took our sensitization to a community in Kadukuchi, that's in Jahi area. And then we sensitized them on how to prevent malaria by keeping the environment clean, ensuring that there are no dump sites, and then when they can, they should wear long sleeve clothes, something that should be able to cover their hands, and then sleep inside long-lasting insecticide-treated net. There is also, you know, preventive measures which include the seasonal malaria chemo prevention, which is taking place in FCT. We have done the first round in 2022, second round in 2023, and currently we are at the planning stage of the 2024 round. And so,
tell me more about this prevention. Is it the 7-day treatment, or, you know, that we used to know growing up, or what exactly does this entail?
This is quite different.
Okay.
It is targeting children between the ages of 3 months to 59 months.
3 to 59 months.
3 to 59 months. And it is a house-to-house, that is door-to-door intervention, where community drug distributors go from door to door, meeting caregivers and giving them anti-malaria medicine. That's a combination of sulfadiazine-pyrimethamine and amodiaquine. Yeah, this is taken, you know, in a course of 3 days, and then repeated monthly for 5 months.
Wow.
Within this
based
period,
on doctor's advice, of course.
Definitely. It's under the guideline of the National Malaria Elimination Program. So what they do is try to build a therapeutic strength in the immune system of these children. And within those periods, they will not come down with malaria.
Within a period of?
The rainy season. It's usually at the peak of the rainy season,
right,
when malaria is at its peak of transmission.
Very quickly, I'd like us to talk about drug resistance and how that is managed as far as malaria is concerned, because there's growing cases of, you know, drugs resistance. What's causing that, and how should it be managed?
That is why we say for everybody who feels symptom of malaria, you just don't go over the counter and take medicine. Visit appropriate health facility, get tested, and take the appropriate anti-malaria medicine.
How much progress are we making on the vaccine, malaria vaccine front? I mean, last year it was approved by President and, you know, from the Oxford University, R21 Matrix M. How much of it are you aware of? How much progress are we making?
There's a lot of progress. There were teams from WHO, Geneva, who visited sometimes early this year. And they went around, and people are waiting for it.
Okay. Great. It's a good place to wrap this conversation. Thank you very much. Chuks Alu is Integrated Vector Management Officer of the FCT Malaria Elimination Program. Thank you for joining us.
Thank you very much.